Anurag Mishra, Dr. Anaga Herur, Sonu
She's in
Goyal.
another hall, and she told me she'll be
Yeah,
back.
I think they're in OPL, they should be here.
Thank you,
Yes,
sir.
sir.
I would like to thank AIOC for this wonderful opportunity. So I will be presenting my experience with textured haptic toric IOL, which is the Hoya Vivinex toric IOL. So this is already known, the theoretical effects of IOL rotation on astigmatism correction. So if there is a 3% misalignment, it leads to 10% undercorrection of astigmatism. If it's 15% misalignment, it can lead to 50% undercorrection. 30% misalignment leads to no benefit of toric lens, basically it is of no use. And if it rotates by more than 30%, then it can even induce new astigmatism as a side effect, and it can even increase the original astigmatism, which will eventually lead to a significant change in the postoperative spherical power as well. So when we look at the various causes of toric IOL misalignment, you have primary causes and the secondary causes. So primarily, if there is a malposition of the lens, there is a error in the calculation of the target axis, if there is an error in the marking of the target axis, or the alignment itself is wrong, certainly you will have a postoperative cylinder residual. And secondarily, basically, if your lens rotates, you have implanted the lens in the right axis, but in the postoperative period there is a rotation. Most of the times it is due to a retained OVD and expansion of the bag, and this leads to rotation. And second reason could be also related to the shape and the material of the toric IOL haptic. So there have been some advances in this field. So what Hoya has basically done, they have given these textured rough haptic surface to the haptics, basically for a better grip in the capsular bag. So this is something which is a new advancement in the field of toric IOLs. So the design, basically, you can see there is this textured a bit of roughness which is provided on the surface of the entire haptic, and also the edge of the haptic is also textured, it is also roughened. So basically this modification, it results in a better adhesion, better positioning of the toric IOL in the bag, and it also prevents adhesions with the optic surface as well. So the lens comes in a preloaded multi-cert injector. So these textured haptics, they do not basically adhere with the optic, and thus when the lens is implanted in the eye, it leads to a very smooth unfolding of the lens as well. So these are some of the technical characteristics of the lens. Not going into much details, but the lens has an axis orientation marks given on the posterior surface. And this was a study done basically to look at the true rotational stability of a single piece hydrophobic intraocular lens, which was the Hoya Vivinex XY1 model. And in this, basically they checked the alignment of the lens at the end of the surgery, after 1 hour, after 1 week, 1 month, and 6 months post-surgery. And what they found was that the median rotation of the lens was only 1.1 degrees with a range of 0 to up to 5 degrees. And all the lenses in the study had less than 5 degrees of rotation from the initial axis following 6 months after surgery. So you can see that because of these textured haptics, the post-op rotation is extremely low. You can say it's negligible only because most of the times we do not want to re-rotate a lens which has rotated by just 5 degrees. So the maximum amount of rotation which was observed was just 5 degrees. So none of the lenses required any repositioning in the post-op period. And the Vivinex toric basically can correct an astigmatism of up to 6 diopters on the IOL plane, and it comes in a Vivinex iCert preloaded injector. So an additional feature of the Vivinex toric optic is also basically an active oxygen processing treatment. So this treatment is done on the optic surface. Again, basically this is done to reduce the PCO rate, and all these features are applicable to all the models of Hoya Vivinex, the geometric, as well as the impress lens. So the geometric trifocal lens also has active oxygen processing treatment and the textured haptics, as well as the Hoya impress, which is the enhanced monofocal lens. So because of this active oxygen processing treatment and along with the sharp edge design, there is also a very reduced, significantly reduced PCO rates have been observed. And this active processing also improves the wettability and adhesion of the hydrophobic acrylic IOL on the posterior surface of the capsular bag. So the lens also has a good tolerance to the post-operative coma if there is any kind of decentration or minor tilt. So up to 0.7 mm decentration is tolerable. So coming to my experience with Vivinex toric rotational stability, I have personally implanted 58 lenses and in my post-operative data, what I found was that the mean rotation was 1.4 degrees. Of course, there were a few eyes which were high myopic also, but I've seen very good stability of these lenses in highly myopic eyes as well, and I'll be showing a case of high myopia treated with this lens as well. So the maximum amount of rotation that I saw was up to 6 degrees. Again, no lens required any realignment in the post-op period, and none of the patients had any astigmatic surprise. So this is a case of high myopia with pre-existing astigmatism, which I recently treated using the Hoya Vivinex toric IOL. And you can see the patient's pre-op biometry here. The axial length of the patient, of the eye was 26.48 mm. The ACD was 3.87. And you can see that the lens power is plus 11.5 with plus 2 diopters of astigmatism. So after the phacoemulsification, this is the last piece, phacoemulsification. You can see that I'm doing the irrigation and aspiration. So I like to make a slightly smaller axis for toric lenses because I feel that it gives better stability. Now this is the use of the multi-cert injector. Again, it's a very wound-friendly and surgeon-friendly injector, and it goes through a 2.2 incision. You can also implant the lens under saline as well. And I like to use bimanual irrigation aspiration cannulas to rotate the lens. And I'm using a markerless system for alignment of the lens. And you can see that the stability of the lens is very good. I also like to polish the anterior, the surface of the anterior lens capsule. So just notice the position of the toric marks as I remove the IA cannulas. So you can see as I remove the IA cannulas, there is no shift. You can see that the lens is very stable in the capsular bag. And that's the end of the surgery. This is the post-operative outcome of the patient. Sorry, that was a video. So the patient did not have any post-op astigmatism, 0 cylinder, and the patient was 6/6 uncorrected vision. So to conclude, the Hoya Vivinex toric IOLs have excellent post-operative rotational stability in my own experience. This certainly leads to improved refractive predictability for corneal astigmatism correction at the time of cataract surgery. And this certainly also gives us a lot of confidence to counsel patients for toric IOLs with greater confidence, because you know that the lens has got very good stability. You're not going to see any post-op surprises. There's not going to be any significant rotation. So you can counsel the patients with greater confidence, and certainly this has made a huge difference in my toric IOL practice, because now, earlier I used to tell my patients, okay, you have a 10% chance or 5% chance of rotation, especially in highly myopic patients, because we know that sometimes they need re-rotation. But now, since I've started using this lens, even in high myop, every type of patients, I'm quite confident in suggesting this lens to them, and patients are also very happy. Thank you so much for your kind attention.
Thank you, Sheetal. What lens were you using earlier prior to the introduction of this lens?
I have been using all brands, basically Technis Toric also. Biotech Toric also.
And you find this is the most stable out of all the?
Yes,
all
because
the
I
lens?
have not done any re-rotation for any eye.
And earlier
but-
you had to?
Yes, sometimes I had to realign.
So this you find is the most stable
Yes,
lens that you found in your practice?
yes.
Actually, it's well established. In our own personal experience, most of these lenses are not to be rotated in the anti-clockwise direction. Occasionally, if it's slightly off and you want to rotate it, the other with the smoother haptics can easily be nudged to the opposite in the opposite direction. But with these roughened haptics, you find that it's much more difficult to nudge them. And once you leave them, as she's shown in the with the overlay also, it stays right there.
Yeah,
And secondly, it's also been borne out with the other companies' experience. It's David Chang had published a significant paper where he showed that compared to the Alcon Toric, the Technis Toric rotated almost 5 times more often. Because of this, actually, the Technis Toric also, they have introduced this roughened haptics now. And that has been available with the Hoya Toric for a long, right from inception. So I think this is the way forward that all lenses will move for rotational stability.
certainly.
I think the texture, the textures and on the haptics have made such a lot of difference. It's not not even in the Technis Toric, even after it was, they roughened the haptics, it was not so stable as this lens.